Call be set aside.
Without objection.
Madam President. Madam President, I believe health care is a human right. And with all the incentives on the table for Georgia to expand Medicaid, it is past time to do so. My home state of Georgia, where state leaders have refused to expand Medicaid, has the opportunity to provide affordable health care to 646,000 people who could qualify. I refuse to allow Georgians to suffer and be cut off from care while politicians play games. And this is why I introduced recently the Medicaid Saves Lives Act. This is legislation that would allow people in states like mine who haven't expanded Medicaid an alternative path to health coverage. Because for far too many, access to affordable, reliable health care is the difference between life and death. Madam President, I agree with Martin Luther King Jr., who said that of all the injustices, inequality in health care is the most shocking and the most inhumane. And so I'm grateful that this plan, the Medicaid Saves Lives Act, which I introduced the other day, is positioned to be included in the forthcoming economic package. And that's why I rise again on the Senate floor to tell the story of another Georgian, a story that gets to the heart of why this bill is important. This is Amy Belowski. Amy is an owner of a small business, Harebrained Productions. It is an event planning and entertainment company in Tucker, Georgia. As you can imagine, Amy's company took a significant hit during the pandemic. Unable to book regular gigs and plan events that all of us miss as we have been clawing our way back from this pandemic. Amy qualified for unemployment benefits this past year. And with that critical support, Amy had temporary access to affordable marketplace plans created by the Affordable Care Act. But with the end of Georgia's unemployment benefits looming and the entertainment sector still suffering from the effects of the pandemic, her access to coverage, the coverage she so desperately needs, is on the brink. Again. At the same time, she will have to manage her thyroid disease, high blood pressure, pituitary gland tumor, fibroids, and all the other health hiccups that come along with aging. If Georgia was to expand Medicaid, or if there was a federal Medicaid program for non-expansion states like Georgia, Amy would no longer have to worry about getting reliable health coverage for her chronic conditions. This is the human face of the public policy we make, or the public policy we fail to make. As our state's health care options stand now, Amy says she, quote, doesn't think they care about people like me falling through the cracks. Even more disappointing, when asked what Medicaid expansion would mean for her, Amy was reluctant to even picture that future. She said, well, it's really difficult to say because I've never had consistent health care. It is hard to imagine. Think about that. It is hard for somebody who works every day with a kind of entrepreneurial thrust, serious work ethic, grit, and determination in the richest country on the planet. She says it's hard for her to imagine having consistent health care. She says she's used to being shoved aside and doing without. But with all of Amy's health issues, doing without, as she puts it, can only work for so long. We're costing Georgia more and more every day by not providing access to health care to the people who need it most. Like Amy's story speaks to, without affordable and comprehensive coverage, preventive care and annual appointments are skipped, conditions that could perhaps be treated or seen at their early stage or prevented worsen. And Georgians end up using emergency rooms instead of addressing these health issues in primary care appointments months prior. This past year, Amy herself had to go to the ER because of chest pains. And with a history of high blood pressure, she couldn't ignore the sharp pain in her chest that wasn't going anywhere. And so she made her way to the ER. After all, what if it was a heart attack? A short stay later, after spending less than an hour in a hospital room, she went home with a $3,000 bill. That's bad policy for her. It's certainly bad policy for every Georgian. What kinds of costs would be avoided for the hospital and for Amy herself if she had access to a primary care provider through Medicaid and more regular, affordable, consistent access to care? Madam President, in other states, Amy would be eligible for Medicaid. And according to Amy, access to reliable, quality, affordable health care through Medicaid would be nothing short, she says, of miraculous. Amy is one Georgian who represents the stories of hundreds of thousands in our state and across the country who need the Medicaid Saves Lives Act. And until we get this done, because I believe that health care is a human right, I'm going to keep lifting up Amy's story and the stories of other Georgians who would benefit from this life-saving legislation. Thank you, Madam President. I yield the floor.